If we're not careful, this is Henry talking to you all. The cost of healthcare is going to get so high where people are going to have to make decisions. Do I eat today? Do I pay my rent today? Do I go to the doctor today?
Since the passage of the Unaffordable Care Act,
I really don't understand why they say this Unaffordable Care Act. It was super affordable, but I am glad he didn't call it Obamacare because I don't understand that.
Sometimes referred to as Obamacare, big insurance.
I'm sorry. Forgive me.
Insurance company has gotten rich. It was meant for the insurance companies, not for the people.
It's insane. One of the biggest things is pre-existing conditions, and one of the things that I've been pressing on people, if you're not careful, they will do away with pre-existing conditions. What that means is if you have a diagnosis of, let's say, cancer, and then you need insurance for whatever reason you didn't have it, when you go to get it, the cost would have been so high, you would not have been able to afford it, or you could have been denied. So now this makes the insurance companies give you insurance, even if it's at a higher rate, but now you can go through and get treatments and stay alive. So you can get chemo, radiation, things like that. So while they may have made money other places, as someone who's in hospice, I can tell you, they've definitely ended up paying for more treatments on the back end. So therefore, it's difficult for me to agree with what he's saying on that part.
With our government giving them hundreds and hundreds of billions of dollars a year, as their stock prices soared 1,000.
Again, this is just, there's no context here. And it's not that because of the way our government is set up, they do have a lock on the entire industry. All big insurance companies do. But again, this is something that you all let happen. So you don't have a situation where we can independently pick our own insurances because the barrier to entry to starting an insurance company is through the roof, right? If everyone could open one or people could get together and open one, then you maybe would have better outcomes. But because you can't do that, I don't really know if that's really the right type of argument that I would have been making.
Prices soared 1,000, 1,200, 1,400, and even 1,700%. Like nothing else.
Market also went up significantly altogether, right? Not 1,700%, but just you gotta have some context with some of these things.
That's why I introduced the great healthcare plan. I want to stop all payments to big insurance companies and instead give that money directly to the people so they can buy their own healthcare, which will be better healthcare at a much lower cost.
That's probably not possible. I do agree that that would be fantastic if we can get healthcare as cheap as possible. But the Affordable Care Act, a lot of that plan, those were subsidized plans. So if you take away those subsidies, which is essentially what he wants to do, you still have to make that up. So what I tell you that I'm seeing right now, the person who had a $700 plan is now facing a $1,500 plan. $1,000 plan is now facing a $2,500 plan. If you want the same type of coverage. So what you're gonna have is people having much higher deductibles and they're not gonna be able to actually go to the doctor at all in the future unless they have a copay through the roof. So again, with some of what he says or what is being said in this administration, I would just want to understand how they plan to accomplish these things, because for me, it would be pretty much impossible to do. So I was interested to see Congress kind of be here and make these faces, and I've been saying this for a while when we brought the insurance people to the platform and we had this congressional hearing, and nothing happened afterwards. It's again, I don't understand that whole process and why even waste their day of their time if you're not going to do anything after they've come in and discuss what they're doing and going to continue to do.
In addition, my plan requires maximum price transparency. That's a big deal.
Now that is something I can get behind. And I've been saying this for forever, because you all in this market, right, the medications, you all have no clue how much it really is. Even as he gets to later about TrumpRx, I'm not actually anti-TrumpRx. I'm anti him putting his name on it. I think it is something that it should be less about him and more about doing better for the country. But what he could do in theory is lower the cost of medications. Now, how I think it will work, I could be wrong. Let's just take a regular medication. Let's just call it a prednisone or something, right? And let's say your out-of-pocket cost for this is $40. But the true cost, these are just random numbers. The true cost, let's say, was $200, $220. What he might be able to do, more than likely, is negotiate that cost down to where the insurance provider will then be paying less for said medication. But you will still have the same copay, that is ideally what I think is going to happen, which is why I think so many people are actually for this. I don't think it's actually a thing for the people. I don't think your copay is going to change, but I do think what they pay out to these medication companies will be less. Now, and I said this before today in the car, I was talking and I said, America as a whole, and I don't have any data to prove this, it's probably 5 to 10x the cost per person per year that we spend on medication. So he does have, and I'm being honest, some leverage. Because if they don't go by said things, they will lose a ton of revenue. Do I think that that's the right way to do it? I don't know. But again, he's a businessman. And so he does have some leverage given that type of information. But what do you think?
Sounds so simple, so big. And I did that in my first term, and the Democrats immediately terminated it with full knowledge that they were doing a very bad thing for the people. Costs were going to go way up, and that's what happened. And now I'm bringing them way down on healthcare.
So that's actually not what happened. If you guys remember, I did a video early last year, and I talked about explaining to you guys, hey, what's about to happen is the cost of your drugs are going to go through the roof. So what he's essentially doing is bringing the costs back down to where they were last year before. And you're saying, Henry, how would you know you don't pay for drugs? Hospice companies have to pay for the medications directly related to people's diagnosis. So we absolutely pay for drugs. So all the medications that I've seen, our medication bill went up 30% last year versus the year before. This year, it is still very, very high, but we do expect it to come down. But it's because he's already pushed it up. So if something was $100, you make it 130 and you bring it back to 105, I'm not really sure that I'm going to say you accomplish anything. So, but that's just something to think about. Like, that's really what I'm seeing happening in the market in real time.
Healthcare and everything else. I'm also ending the wildly inflated cost of prescription drugs like has never happened before.
Again, I just said this, I didn't even, but it's he made it go higher. Now you're bringing it back down to where it was a year ago. It's like, yeah, you are bringing it down, but it was not this high originally. I had to do a whole video and a whole tutorial on telling people how to get Medicare Part D, as in dog, because they were calling and they cannot afford these medications. So people have died from not being able to afford these medications. So with them going to the roof and you bringing them back down, I guess we're appreciative of that, but you're the reason that they went up.
Other presidents tried to do it, but they never could. They tried. Most didn't try, actually. But they tried. They said they tried. They couldn't do it. They didn't even come close. They were all talk and no action. But I got it done. Under my just enacted most favored nation agreements, Americans who have for decades paid by far the highest prices of any nation anywhere in the world for.
It is true. We do pay a lot. However, they're not being made here, right? That's the other thing, right? When something that we have to get, they gotta do it. They gotta bring it in here. A lot of what you all are hearing is like fluff, for lack of a better word, right? He's creating this space and he's creating this moment where it's like, if I watch this, the longest State of the Union ever, they said, and from all the conversations I've had today, very few people can give me any points that he made. Very few points, because he spent a lot of time saying, I'm the best. No one ever tried it. It's like, but there was no true action plan given on how he's going to actually do anything. So that, for me, I have to say, as someone who's in it, on the field, every day in the field, I don't think a lot of this stuff is actually doable, especially not in today's economy.
For prescription drugs will now pay the lowest price anywhere in the world for drugs, anywhere.
Highly unlikely, highly unlikely. But again, I will say, because we use drugs so often, and this is where we get into businessmen and having leverage, he does have leverage, but at the cost of the American people, right? Again, going back to negotiating, how we negotiated those SNAP benefits. They negotiate based on leverage. So if he says, well, you can't give us this medication if you don't do this, which by law you would say, that's illegal, that can't happen. I don't think you want to get into what's illegal in this administration. Like we're way past what's legal and not legal. It's how we feel doesn't matter. So we have to get into, this is what could happen. If he got into a situation where he had to negotiate with leverage, he could say, well, you can no longer come to our country and do this. But the people who need this medication would essentially be the ones who hurt the most.
Anywhere, the lowest price. So in my first year of the second term, should be my third term, but
we just talked about what's legal and what's not legal. He's telling you to be my third term. That's not technically legal. So you can't really go by that anymore. We just go by, listen to what he says and take it for, hey, he's very serious when he talks.
Strange things happen. I took prescription drugs, a very big part of healthcare, from the highest price in the entire world to the lowest. That's a big achievement. The result is price differences of 300, 400, 500, 600% and more, all available right now at a new website called TrumpRx.gov.
Okay, and I'm gonna say this TrumpRx.gov. You all, if Obama had come out and said Obamacare, you all would have made this huge thing. Like, it would have been like the audacity of you to put your name on something that's supposed to be for the benefit of the American people, but yet we call it TrumpRx. And again, fundamentally, TrumpRx, I believe, is not a terrible idea. I do not think it'll work on behalf of the American people. I think your copay will still be your copay, but I do think the insurance providers will be able to pay less for said medication. But I just don't understand. How is it that we allow one thing, and on the other side, it's like the world's gonna end? When I look at the Affordable Care Act and what it meant to us as Americans and why it was so important, and so many lives were saved because of this, and the way that they came in and tried to push it out the door and were willing to say, our insurance or you can't eat, it tells me a lot. That's what SNAP benefits. It tells me a lot about the type of leverage they're willing to use to get things done. I should not have to give people bonuses so that they can get SNAP benefits. And then people are saying, well, they shouldn't need them anyway. Again, I don't control housing prices. I don't control gas prices. I don't control the price of food. They do. They control this, right? They control this with tariffs that I've been telling people for years. You pay, the consumer pays those tariffs. They control it with inflation. So these are all things that have happened that, I don't know where we go from here, but I will say I would love to hear, or at least read, if they could give me something to read upon, what they're going to do to make the lives better for the American people. If we're not careful, this is Henry talking to you all. The cost of healthcare is going to get so high where people are going to have to make decisions. Do I eat today? Do I pay my rent today? Do I go to the doctor today? And then you're going to have people like the gentleman who decided to not pay for his inhaler and go pay his rent, who die as a result of that. That's where we're headed if we're not careful. I look at two-parent households or two-income households and how we need now 2 incomes to maintain one house. How did we get here? Why did we get here? Why did we allow this to happen? And why is the cost of everything continuing to go up? It's almost as if, and I'm going to say this, a lot of people are going to feel like they're better off not working and getting government assistance than working and not being able to afford anything. And when you look at the numbers, particularly in states like Georgia, Florida, Alabama, Tennessee, I understand that logic. You cannot work. They're going to give you Medicaid. They're going to give you food stamps. They're going to give you a housing voucher. You're going to get a ton of things you need to survive. Or you can work. You don't get a housing voucher. You can't afford rent. You don't get food stamps and your food price through the roof. And most importantly, you can't afford your health. Let me know what you all think in the comments. And if there's anything you would like me to do outside of run for office, I'd love to hear your comments. Thanks.